What's going on, family? How's everybody doing on today? I hope everybody's doing well. Welcome to another week of Mind Your Mondays. I'm your host, founder and visionary of Mind Your Business, Marquez Johnson. And we're so excited today. But listen, coming into this, y'all know I want y'all to do two things. I need y'all to like and I need y'all to share. Okay. Which is going to be an interesting week this week. Last week, we intended to have my special guest on, but we had some technical difficulties even this week. We're just moving around trying to get in some new, devices and equipment to make this a greater experience for you. But we run into some snags, but nonetheless, we are here and we're very excited. I'm excited to have my sister, my colleague, my friend on this week with us, Ikeshia Smith. She is a licensed therapist, soon to be a doctor. And I'm extremely excited about this week because we're talking about the power of pain. We're talking about the power of pain. Listen, there is a great power in pain. We talked about it. We hit on some things last week, but it's going to be even greater this week because I have a great friend online, and we're ready to dive into this. How are you feeling today, Ikeshia? How you feeling?
I couldn't be better. It's another day, and I'm just trying to embrace as much as I can.
Yeah, for sure, for sure. Listen, we've done a lot together. We
Yeah.
tag team. Actually, in fact, Ikeshia is our chief strategist for M.Y.B. So this is very exciting to have you on to just get a little perspective from the leadership side of M.Y.B. But just to know that everyone that is in place is well equipped and we're ready for this new adventure and to do something special within this thing called mental health. So let's get into this, the power of pain. So we talked about last week about how pain is significant to us, um, particularly because when you have pain, it's an indication that something is wrong. And on a lot of levels, we experience pain, and a lot of times you try to avoid pain because who wants to feel pain? Who wants to go through that?
Right.
And so particularly for each individual, the level of pain could seem greater than some people. In fact, the source of pain is different for other people. But nonetheless, we all experience pain. So one of the things that I want to touch on is the kind of like the avoidance of pain. We all try to avoid it. We all try to go around it. We try to prevent certain things from happening, but life happens. And we can't stop life from happening. But I want to just get a perspective from the licensed therapist herself, soon to be a doctor in a few months, and your perspective of pain and how those indicators that something is going. How do we just you know I want to say accept it, but how do we go into that mode and allowing pain to happen and to just allow it to be a teaching mechanism for us? What do you say about that?
Working with individuals across the lifespan, psychological pain is really something that people like to run away from. And I think that some of that has something to do with stigma, as well as how we view ourselves as humans, strong, resilient. And so, while that is great, and that is definitely something that we can utilize to progress and push ourselves through, I think there is a way for us to be human as well. And I think we miss that aspect of you have emotions and you are able to feel those emotions. I think that sometimes we have a misconception of what emotions are and what they do. And so when we want to define that, emotions are not good or bad. They're just emotions and we should be able to feel them like a human. And I've seen a few internet gurus who tell you, oh, you have to control your emotions, you have to control your emotions. Well, sometimes I want to, comment on those things about controlling your emotions. Well, really, you can't. You can control your behaviors, but your emotions is essentially your emotions, and they actually are beneficial to your survival. And sometimes when we're feeling that emotional or that psychological pain, we tend to want to run from it because it's something that everyone has told us on the internet you shouldn't have. when in actuality, that's not true. So we have to, first of all, attack stigma hardcore. And we also have to understand that we're all humans, and psychological pain, like you said, life happens, and you will get hurt by something or someone, or an event is going to happen where it's going to make you uncomfortable. And so we have to be able to, grasp it and say, "Hey, I'm upset. This hurts. Let me feel it." Instead, we tend to avoid it by engaging in risky behaviors. And what I mean by risky behaviors, I mean by, we're going out drinking and smoking and engaging in risky sex, or jumping in other relationships, or just doing something, even self-harming behaviors, because we don't want to feel it. We don't want to, you know, understand that we're humans and it's going to hurt. So that's my perspective and what I've and noticed being a therapist over these past, 2 years, and being a social worker over the past 5 years. And then, understanding the range of emotions over these past 5 years, and understanding how that works biologically, um, you know, gave me a whole different perspective on psychological pain and how us as humans handle it.
Well, you said something that's very profound. You said actually feeling that pain.
Mhm. Mhm.
Um, that's profound in of itself because, like I said, we try to avoid it, and I think a lot of times, particularly for us, being a mental health organization who is faith based.
Mhm.
We kind of sometimes uh, tiptoe around feeling that pain. You know what I'm saying?
Mhm.
It's like we spiritualize everything, and it's like, all right, God is going to deliver us out of the pain. But what about, um, you know, actually going through it? What about actually absorbing that, giving ourselves time, allowing ourselves that experience? Because if we come out on the other side and we haven't learned anything, or we haven't developed, and we come out of that and it's come out of it, I would say, like prematurely, now we haven't developed anything, we haven't learned anything. So actually allowing ourselves time, giving ourselves grace. God gives us grace, so why are we so hard on ourselves? You know what I'm saying? If God has given us love, why are we so difficult on ourselves when it comes to that? Allowing ourselves to feel the pain, knowing that God is with us, and
Mhm.
we have, an entity with us that allows us to absorb that, and we can fall back on Him and allow Him to pick us up, even in the middle of the difficult times. Pick us up, dust us off, and allow us to keep going. So it's actually allowing ourselves to feel that, and knowing what it's like, because there is no experience, there is no greater teacher than experience.
Mhm.
I would say there is no greater
Absolutely.
teacher than experience, and we need to allow
Absolutely.
ourselves to experience that.
Absolutely. I want to also piggyback on the word grace. I often tell my patients that as well, like, give yourself the grace, grant yourself the grace. And, I have had so many, especially women, come into my office and they're talking about, well, I made this mistake, and they beat themselves up for years. Like, people stay in these stages for years because they're not granting themselves the grace. Like, hey, I made this mistake, or I made this decision that may not have been the best decision at the time. How do I learn from this? And instead, it's, I'm going to beat myself up. I'm going to go through this emotional suffering because that's what I deserve. And
Wow.
so it's a lot of that internalized feelings about ourselves, because we believe that we made this one mistake and now we deserve the suffering, the pain, and
Yes.
all this that's coming to us, without actually understanding you can process through the pain, but also progress forward.
Yes.
And I think that we get stuck. There's
Yes.
a phase we get stuck in,
Yeah.
and it's either I'm strictly this, I'm just going downhill,
Yeah.
or I'm going to strictly avoid, when really we're on a spectrum. We're on a spectrum. And a lot of people live in the black and white thinking. And I think that that's, sometimes have tripped us up in how do we address psychological pain, because what I've learned is that the discomfort tends to be something that a lot of people don't want to do. And no one likes to be uncomfortable. No one likes to understand accountability, or, take on accountability, because it's just an uncomfortable feeling. And so sometimes our psychological pain can come from our own decision making, but that does not mean we have to stay there or beat ourselves up for it. And I think that that has something, I think that's something that we tend to struggle with as humans. But I also think that that's something that can be taught as well as when we break stigma.
Breaking that stigma, and is very imperative, particularly, and we touch on this, the African American community. The African American community, we relate to that word suffering, and I believe that in of course, a traditional environment such as church, of course, we go there for our spiritual uplifting. We go there for our enhancements, and allowing ourselves to be to actually feel free. Um, but it's like that moment, or those moments of suffering, though, um, and how we relate to it so much as a culture, so much so that we are reticent on taking opportunities to heal and actually talk about things that we've actually been through. There are a couple of things, a couple of factors that go into that, and I know we've had discussions on this, about the limited availability of therapeutic resources for the African American community. I mean, let's just throw it out there. There has been throughout time limited availability, but I don't think there has been enough, or enough, voices, to actually go against the grain and make that availability for us. And
Mhm.
I think we're in a pivotal time that we have those voices in the earth that
Mhm.
are willing to advocate for the African American community, that we can break that stigma that comes
Mhm.
along with feeling deserve this pain, because we're so used to it.
Right.
We don't have to. We have resources. We have educated Black men and women who have gone through the struggle, who have educated themselves, and we are equipped to help our community break that stigma and understand it's okay for you to talk. It's okay for you to open up, because that pain that that discomfort that you're avoiding, it is only intensifying when you repress and you suppress those emotions and those feelings throughout time.
Right.
So now we're breaking that stigma, because now we're opening up. Now we're saying it's okay to talk. Now it's
Mhm.
saying, okay, if I share just a little bit of my struggle, and let you and break, that barrier, that wall that says that we have to appear as though everything is always all right, and we don't. Now
Mhm.
we're on a good path, because now we're entering into a realm that we've always desired, but we never gave ourselves, it was never available, nor did we ever advocate for ourselves to make it available. We're in a pivotal time.
Right.
Let's talk about that a little bit.
So I have 2 points on that.
Sure.
So when it comes to, the whole, African Americans not getting the help that they need, and not having the adequate resources, one of the things I talk about in my dissertation talks about the mental health disparities among the African American community, specifically among Black women. But as a whole, since we are talking about African Americans as a whole, what they tend to leave out sometimes is how the system has been set up systematically and who has the power to make those policies. So what I had found out is from in 1960s, when Lyndon Johnson was basically the forefront of community mental health, funds were dispersed to communities. However, they were disproportionately not given to the African American community. So that was the start of our inability to have these resources that were needed, because from the government standpoint, we were not able to have those resources, proportionately given to the African American community. So I also looked up, what's his name, Benjamin and Samuel. They were I believe they were one of them was the godfather of psychiatry. Um, I think Benjamin Rush and Samuel Cartwright, maybe.
Okay.
Don't quote me if I'm wrong, but they were had a lot to do with mental health and psychiatry,
Wow.
and they were a lot of racism, a lot of misdiagnosis, which is why African American men were disproportionately diagnosed with schizophrenia, and there was a lot of mistreatment and guidance with that. And a lot of practitioners followed behind them and disproportionately, or not disproportionately, but assigned diagnoses that
Yeah.
were not appropriate for Black men.
Wow.
And so there has been a long history, at least from the 60s, um, that has placed the Black community in a position to not thrive when it comes to mental health. So that's how that's how that Black community started to turn toward their churches to look for the mental health, because that was not granted to them.
Yes.
And then a lot of Black men were thrown into mental health hospitals, state hospitals,
Wow.
and things of that nature. So it was very, very not a good time for the African American community to reach out for those resources, because technically we didn't have them, and the people who were treating us were not treating us appropriately,
Wow.
nor ethically, by the way. Um, so I think that, understanding our history associated to why we don't have mental health services is very, very imperative to where we are today.
Yes.
And even with today, in a couple months I'll be hopefully Dr. Smith. And even with psychology, 2% of African American psychologists, as far as males, are 2%, and Black women are 3%. So even now, they continue to gatekeep that profession. And so, but like you said, there is the upcoming of a Black mental health clinicians who are trying to turn this over and trying to, like, switch up the narrative, and understanding and telling the current researchers and scientists that, hey, we have, Black people who are wanting to come to therapy. However, the blueprint of a lot of these evidence-based practices are mostly geared toward white people and a specific cultural group. So unfortunately, while, cognitive behavioral therapy, all the select therapies that we have can be beneficial, but they're only beneficial for certain groups. So that's why it's imperative for our African American clinicians to have a voice and advocate, because it gives African Americans the ability to use treatment modalities that can be beneficial for them.
With the American Foundation of Suicide Prevention. And when we, upon our initial partnership with the representative, she spoke about the disparity of African American therapists and clinicians. And she was a Caucasian race. And she's like, wow, like, I'm really excited that you even reached out to us because we're in need of this. And she was like, it's made up of, you made the statistic, 2% men, 3% women, but mostly women, and the Caucasian women at that race. And she's like, she's extremely excited the fact that we even decided, to reach out and to partner, because we need that gap to be bridged. And I believe this too, Ikeshia, because a lot of us, we like to talk to people that we can relate to. You know, um, I don't want no superficial answer. Um, Go to school, get the knowledge, of course. Gain the knowledge so you can, diagnose, um, professionally, and diagnose, efficiently. But be able to relate to me. You know, how can I talk to someone, you know, about going through the process of chemotherapy when they've never had cancer, when they've never went into remission themselves? And I can express myself, but at the end of the day, I want to talk to somebody that has been through something and that qualifies you to talk to me. And so a lot of times what goes along with that stigma is we go and we sit down and we talk to someone who don't look like us.
Correct.
No. And so how, can, you're sitting on the other side and you can't relate to any of my historical struggle. You can't relate to any of, uh, you know, uh, the heritage in which we, our lineage in which we come from. To be able to understand some of the deep psychological roots that come along and then it's passed down through generation.
Right.
And so that is very imperative too. If we get the courage and like I said, we're on that path of there being a great influx of African American clinicians. We have that courage to go into that. We'll start to see that bridge being gap,
Mhm.
that gap being bridged rather, because now we're starting to see people that look like us. And so we reach out to those individuals that look like us. And it's not to say that, anyone that don't look like us don't need help, but come on, let's be honest, we're targeting a specific area here because this is the area that is hurting. We're
Mhm.
hurting. And so for that particular group, now we have someone that we look like. Now we have someone who is saying, okay, now we're breaking, you know, the monotony here, and we got somebody that actually look like us. Maybe they can understand what I'm going
Mhm.
through. Maybe it is all right to talk. If it's all right for now that I have someone that actually listen.
Right. Right. And, sometimes having those, factors, which lack of representation is one of the reasons why African Americans don't go to therapy because, think about the current, political climate today and with gun violence and police brutality and how that affects, African American men and mothers. And so, sitting across from somebody who does not look like you and you have been going through this, anxiety and just this fear of your children or of your significant other or your family member. And this person has you know, no ability to understand that or have their own preconceived notions of what they think black people are like. And
Yeah.
so now you have all this bias and, cultural clashing, you know, trying to develop this therapeutic alliance, but
Yes.
it's not happening because, there's so many things that are different about us.
Yes.
So fortunately, there has been some level of cultural competency increase among non minority clinicians. It is just now about doing the work and getting out into the Black community and seeing what they need, specifically in their churches. And so I am hopeful that, with the events that have happened over the past 4 or 5 years, that there will be some more clinicians, like you said, that are happy to see us and wanting to bridge that gap to ensure that the African American community is getting the resources that they need.
Yes. Absolutely. I mean, everything that we face, through, as you stated, the last 4 or 5 years. I mean, from the government,
Mhm,
to the police brutality, um, to, um, you know, COVID-19.
mhm.
I mean, we've just been getting hit left
Yep.
and left and right, and I think there is no better time than now.
Mhm,
That we have there's a paradigm, literally a
mhm,
paradigm shift that is happening in our on our behalf for our favor, in
mhm.
our favor. And it would just be so incumbent of us to just overlook the opportunities that we have to do something
Absolutely.
extremely special.
Mhm,
And people ask all the time, Marquez, there's so many mental health institutions, foundations, agencies, hospitals that are doing something. What makes yours so different? What makes yours so special? Because mental health is an action word. Mental
I
health
like that.
is an
I like
action
that.
word. It is not something that you just say, but it's something that you have to actually put into practice.
Mhm,
Everything in life is centered around psychological makeup of us, our mind.
Yep.
I mean, it starts from a baby. I mean, you've been in the baby, and when you really can't comprehend, you still have a subconscious, and everything is being stored in your subconscious. And then once you start to form your conscious and your analytical mind, everything starts being filtered and thrown around in there. And now you start to comprehend, and you start piecing things together, and that is all psychological.
Yep.
And how we behave, our character is conditioned upon what we dealt with, what we experienced.
Mhm.
And now we have the opportunity to explain to people that what you experience, it doesn't have to be the definition of who you are, but you can learn from that and become much greater and become much,
Mhm.
and move in who you are, move in what your purpose to do, what you're destined to do. And I believe starting there, bringing it to an area that you stated it earlier, that's why we went to church.
Mhm.
And we stuck there, we stayed there because that was a safe haven for us throughout
Absolutely.
generations, throughout time. And now we have something to, why don't we bring it there? Because I believe this, and you can you can attest to this. There are pastors, and there are a lot of ministries, there are a lot of community leaders that believe in therapy. They believe in counseling and
Mhm.
getting help, and they actually recommend that you
Mhm.
go get help. And I think that is great, and I think that we're off to a wonderful start. And even suggesting to our race and to who we are, go get help.
Right.
But I believe that with Mind Your Business, we have an opportunity to actually put help into action and put it on the front line.
Mhm.
Because sometimes it's like telling a kid, uh, you know, go make your bed, or
Mhm.
go brush your teeth, or go fix you a plate of food. Or well, they'll probably do that. Or go brush your teeth, or go do your chores, and then you leave the house, and you come back. And what's the chances that your kid actually did what you told them to do, because now they weren't supervised, and they didn't do it in front of you.
Mhm.
So why don't we bring it to the front line where we already are, to an environment that we feel most comfortable, and a time that we're most susceptible and emotional,
Mhm.
and actually put it on the front line and say, here, it's okay to bring it into this environment, because quiet is kept. When we worship, it's all psychological anyway, because God, He speaks to our spirit that talks to our mind, and it's psychological anyhow. So why not bring it here and say, okay, since we're here, why don't we confess about all the things that we've been through, and allow ourselves to be brothers and sisters and help each other talk through it?
I agree. I think that it is important to bring that to the front line, and having these pastors open that avenue and creating that space for us to be vulnerable. I do like how you say, come, doing the worship. You are the most vulnerable during
That's
your worship. I've been to church for years, so
right.
that I feel like a lot of people become vulnerable in that time of worshiping. So, using that ability to also say, hey, you can be vulnerable with talking about things that happened to you.
Yes.
And I think that that is a great way to intersect with spirituality and religion as well as mental health, is using those positive useful tools that you use in your spiritual life, that you can also connect over to the mental health side.
Yes.
I think that would be very useful.
Yes. Yes. Ikesha, we've been on here for some time.
Yeah.
We try to, stick within the 30-minute segment, but I am so grateful to have had you on and actually give your expertise and your advice and your insight on all of
Mhm.
these things. There's so many great things to come.
Yep.
I appreciative of your time. Aikisha, tell the people. I want you to tell the people where you're from. I want you to Kind of give your background, where you're from, what you're doing. I know you said, you're on your way to get your degree, and what you got going on here within the next few months.
Yeah, so thank you. I am first I graduated from Kent State University. That's in Kent, Ohio with my bachelor's degree in human development. And then I went forward to be a licensed social worker, and I got my master's of social work from Case Western Reserve University. And I thought that, it was important for me to up my clinical game. So I am currently a Capella student, getting my doctorate in clinical psychology, which I am currently waiting to defend my dissertation next month. So I'm hoping to be Dr. Smith by September. And I've also published 2 books. I'm really hoping to publish my dissertation at some point, which currently talks about gun violence impacting Black women using critical race theory. So, my specialty is talking about mental health and racism and how it impacts African Americans. And I don't know what I'm going to be doing next, but that's what I've done already. So I guess stay tuned.
Yes, I like that. Stay tuned. I love that. I love that statement. Stay tuned. We have a lot going. You know what? I'm excited for you, Ikeshia. I'm excited to have you on our team.
Absolutely.
We're looking forward to doing some very, very special things here in the now. I believe that our future is now. And so I'm extremely excited. Thank you for those of you who are watching, for those of you who may tune in now or later, I want you guys to partner with us. You should have at the bottom of your screen, how to partner with us. You can give, text our app 94253, M.Y.B. Give M.Y.B to 94253. It's kind of rhyme there. I kind of like that. Give M.Y.B to 94253. You can give a donation. You can partner with us that way, or you can become a member of M.Y.B. We just launched our campaign, and we're excited that we're opening up the opportunity for people to partner with us and become a member of M.Y.B. What does that look like for us? You can partner with us, become a member. Become a bronze member, silver member, gold member, and platinum member. What does that look like? Well, our bronze membership is $10 a month. What would your $10 a month go to? It will go to helping us sponsor our community, give back to our community, sponsor people to get massages and to get, what we, you know, diet regimens and workout plans, because all of that has a lot to do with your mental health. And so we send you to the spa and get a nice relaxation massage to decrease your anxiety and just reduce a lot of stress. You can also partner with us for $15 a month at the silver level, and that is to help us with our programs and services. We have a program that we implement with our partnering churches called No Judgment Zone. No Judgment Zone gets deep. And I know, Ikeshia, you've been at our No Judgment Zones, and
Yes.
it's very, very deep and personal. And we just have a good time allowing people to open up, express themselves in a traditional environment, but in an untraditional way. And so it allows us to, give resources to our partnering churches for that. We're starting a program called Hollowed Hands. We're still in the make of that, but it's going to be something extremely special. Or you can partner with us on the gold level. That's for $20, and that could help us with our digital ministry. A lot of what we're doing is digital now since COVID-19, and we have to make sure that your experience is just as good as ours. So that helps us with our videography, with our photography, with our marketing, and our graphic designs and all that good stuff. You can also partner with us on the platinum level, because I like that platinum, that platinum. Give me that platinum card for $25 a month. And what that can help us do, it can help us with our events and getting everything that we need for our events. Our events, venues, and all of our sound engineering and marketing and catering and all that good stuff. So just partner with us. If you say, hey, I'm going through a little financial hardship, so partnering each month may be hard. Well, you can do a one-time payment of $75 to donate to us, and that'll help us across the whole board. We just want you the opportunity to partner with us and become our family. Mental health is a family. and we can't do it alone. We can't go it alone. We have to do this together. So if you become a member, I promise you, you will be included. There are a lot of incentives that come with being a member, not just for those other individuals or for us. There's incentives that come along for you too. We want you to go to our website, www.mindmyb.org, and find out what those incentives are. There are a lot of free things that we have for you, a lot of things that we're ready to give away if you become a member with us. So thank you again. Thank you for your time. We're looking forward to next week. Dr. Ikeshia, I want you to just give something, just an encouragement and empowerment, and we're going to be getting out of here.
Oh, geez, he put me on the spot. um, I would have to say I am reading a new book called The Body Keeps Score, which is a trauma, basically, mostly about trauma. And one of the lines that they said in that book was, "Our greatest suffering is the lies we tell ourselves." And so I want to encourage everybody that if you are going through something and you need to reach out to somebody, please do. To tell yourself that you are not, or to wear a mask, will only prolong your suffering. So I encourage you to reach out to someone if you have, are going through something and would like to connect the resources. So that would be my encouragement today.
Thank you so much, Dr. Aikisha. My family and friends, thank you so much for tuning in this week for another episode of Mind Your Mondays. Hey, catch us next week at 7 p.m. We're going to be right here, same time, same place. We're excited for this. We'll see y'all later. Love y'all. Peace.